Hello, citizens of Internet. I am Professor Ajit Virkud from Mumbai, India. Today, I am going to discuss a short topic called Meig syndrome and also what is called pseudo-Meig syndrome. It is important for students because it is a favorite question of examiners in gynecology viva. It also goes by another name, but more about it later. Meig syndrome is an uncommon presentation. It is a triad where a benign ovarian tumor, such as ovarian fibroma, presents along with ascites and right sided pleural effusion. This is a situation where a benign ovarian tumor presents similar to a malignant ovarian tumor. Historical aspects of this syndrome are very interesting. In 1937, Joe Vincent Meigs and John W. Cass, American gynecologists, reported a series of 7 cases of ovarian fibroma associated with ascites and hydrothorax. It was later termed Meigs syndrome by Rhodes and Terrell. Even though the association of benign ovarian tumors and pleural effusion was reported before, details of which I will reveal in the next slide, it was Meigs and Cass who reported the resolution of ascites and pleural effusion after removing the tumor. Eventually, several authors reported similar cases, and Meigs syndrome became a distinct entity. It was not Meigs but Demens who described the syndrome between 1887 and 1902. He was the first one to specify that removal of the tumor, benign ovarian cyst or solid ovarian tumor, that is fibroma of the broad ligament, was essential for the patient to be cured of the effusions and that it was wrong to postpone surgery. In 1937, Meigs arrived at the same findings concerning ovarian fibromas and granulosa cell tumors. Hence, the name of Demens-Meigs, which was given to this syndrome with the agreement of Meigs. So, although students call it Meigs syndrome, ideally it should be called Demens-Meigs syndrome. Meigs eventually redefined the syndrome in 1954. The following criteria are to be met for the diagnosis of Meigs syndrome. 1. Presence of benign tumor of the ovary such as fibroma, thecoma, granulosa cell tumor or Brenner tumor. 2. Ascites. 3. Pleural effusion. And 4. A resolution of ascites and pleural effusion after removal of the tumor. As I have said before, this syndrome should ideally be called Demens-Meigs syndrome. As mentioned earlier, it is an uncommon triad. Only about 1% of ovarian tumors can present as Meigs syndrome. Ascites is present in 10 to 15% of Meigs syndrome cases, and hydrothorax is found only in 1% of Meigs syndrome cases. The pathophysiology of ascites in Meigs syndrome is speculative. Meigs himself suggested that irritation of the peritoneal surface by a hard, solid ovarian tumor could stimulate the production of peritoneal fluid. Samant and Black studied ovarian tumors accompanied by ascites and found that only tumors larger than 10 centimeters in diameter with a myxoid component to the stroma are associated with ascites. These authors believe that their observations favor secretion of fluid from the tumor as the source of ascites. Other proposed mechanisms include development of ascites may be due to release of mediators, for example, activated complements, histamines, fibrin degradation products, etc., from the tumor, leading to increased capillary permeability. Tumor size, rather than specific histological type, is thought to be the important factor in the formation of ascites and accompanying pleural effusion. Ascitic fluid and pleural effusion found in Meigs syndrome can be either transudative or exudative. The etiology of pleural effusion is unclear. Efskine and Terada et al. Theorized that ascitic fluid is transferred via transdiaphragmatic lymphatic channels. The size of the pleural effusion is largely independent of the amount of ascites. The pleural fluid may be located on the right side or may be bilateral. Now it is known that not only ovarian fibroma but also any other type of ovarian tumor can cause ascites and pleural effusion. When any tumor other than ovarian tumor, for example uterine fibroid, causes ascites and right-sided pleural effusion, it is referred to as pseudo-Meig syndrome or Demon's pseudo syndrome. As indicated in this diagram, Demon's syndrome includes all benign genital tumors. The Demon's Meig's eponym is reserved for description of ovarian fibroma and granulosa cell tumors, and the Demon's pseudo syndrome includes all other entities. Diagnosis of the triad requires exclusion of other etiologies and other surgical pathologies. Differential diagnosis of Meig's syndrome includes cirrhosis of liver, hypoalbuminemia, nephrotic syndrome, ovarian or metastatic cancer, tuberculosis, and lupus. Investigations proposed in such cases are pelvic ultrasound to diagnose the size and type of tumor, plain chest X-ray, CA-125 levels to rule out malignancy, and CT or MRI imaging if necessary. Also note that if the ascitic fluid or pleural effusion were to be tapped and fluid sent for histopathology, it would come as negative for malignant cells. Although Meig's syndrome mimics a malignant condition because of ascites and pleural effusion, it is a benign disease and has a very good prognosis if properly managed. Life expectancy after surgical removal of the tumor is the same as the general population. In conclusion, I will say that in Demon's-Meig syndrome, the causative ovarian mass should be an ovarian fibroma, whereas in pseudo-Meig syndrome or Demon's pseudo syndrome, it could be any other ovarian tumor or another pelvic mass such as large uterine fibroid. Broad ligament fibroids are more susceptible to association of ascites and pleural effusion. Resolution of ascites and pleural effusion after removal of the mass is essential for diagnosis. Also, every patient with pleural effusion and ascites with an abdominal mass is not necessarily a malignant condition. Having said that, just because you find an ovarian mass along with ascites and pleural effusion, it does not mean that you don't have to rule out ovarian malignancy or any other malignancy. If you want to know more about this topic or any other topic in obstetrics and gynecology, please refer to my books Modern Gynecology, Modern Obstetrics, and Practical Obstetrics and Gynecology, and other books. For purchase inquiries, contact me on this WhatsApp number. I have also published 2 question answer books which are particularly useful for exam going students. These are Clinical Cases in Obstetrics, 1000 plus questions and answers, and Clinical Cases in Gynecology, 1000 plus questions and answers. You can also follow me on other social media platforms like Facebook or Meta, Blogspot, and Instagram. The links are given here. If you enjoyed this video, hit the like button, share it with your friends, and also subscribe to my channel for more videos like this. Thank you for watching.